Hi guys, it's Chris Kiefer from the COVID Airway Safety course, and I'm just going to talk to you a little bit about team organization. So what we're promoting is that we simplify things as much as possible and make our roles very clear. Okay, so as team leader, I'm going to be assembling my team, and we're going to talk about having a hot team and a cold team. Okay, the hot team is going to be in the negative pressure isolation room and the ante room if you have that available, and the cold team will be outside. So on the hot team, we have 4 people. Okay, we have an intubator, that's whoever's most experienced. We have a ventilator, that's going to be an RT, who's going to manage the vent. And we have a medicator, okay, and the medicator could be either an MD or an RN, and they're going to be pushing drugs during the procedure. Lastly, we have a hot runner, okay, and this runner is going to be in the ante room. All of these folks are going to be in full aerosolizing PPE. Okay, and that hot runner in the ante room, their role will be to pass equipment in from the outside to the inside, as well as to spell off anyone if there is a contamination event within the hot room. Lastly, that hot runner's role is going to be checking everybody's PPE on the way out of the negative pressure isolation room. And by checking, I mean actually verbalizing and instructing the person doffing on every single step of their doffing procedure to make sure that it is done perfectly. Okay, so then on the cold team, we have a charting nurse, okay, and we also have a safety officer, and we have a cold runner. Okay, so the role of the safety officer is to check every single person who goes into that room. They are there to check to make sure that their PPE is done perfectly, and we have a little checklist for that. And just going head to toe, a bouffant if applicable, a face shield, goggles, an N95 mask, a gown, and particularly the gloves tucked into the wrist of the gown. So that is the checklist that the safety officer will complete. The cold runner's role is to bring medications that are needed or airway adjuncts into the hot runner to pass into the room. Okay? So that's how we assign roles using the COVID Airway Safety course philosophy.